Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart, Life as a Dad and a 35-year cancer survivor, available on Amazon. I want to continue on with one of the last videos that I did on good news with cancer survivorship, with more extended good news about cancer survivorship. You know, as someone diagnosed with cancer, all we want to know is that we can beat it and that we will live a long time. And evidently, to science and the media, this long time is 5 years. Well, 5 years is not good enough. Here's how the conversation went for me with my oncologist 38 years ago. Okay, so doing the math, that was way more than 5 years ago, and you can see where I'm going. Quote, Hodgkin's has a very high rate of remission rate, and once you hit 5 years, there's a confidence that you will not have to worry about it coming back. End quote. Now, most of us cancer patients and survivors have likely heard similar, but in that moment, all that stands out to us is, so it's gone forever then, right? As in cured. And then my doctor said, I don't like to use the word cured. I prefer remission. Well, I prefer the word cured, so if the goal is to have cancer gone forever, does it matter which word gets used? Technically, yeah. Remission means that there are no longer signs or symptoms of any cancer remaining, especially per labs and scans. That means the cancer is not expected to return. But it doesn't mean that there could not be possibly any remaining cancer cells left, which could result in a relapse. And while the oncologist may be confident in the treatment, they are not willing to bet their house the cancer is guaranteed to be gone. So then what good is the word cure? Cure means that cancer is permanently gone. What does that mean exactly? Well, how long does it take to declare permanently? After all, I'm in remission 35 years. Isn't 35 years long enough? The truth is, remission has been so ingrained into my thinking that with survivorship, I still only refer to myself as being in remission. Okay, so regardless of the tomato argument of remission versus cure, hitting that 5 year mark is a good thing. We all want that. But is that all that there is? Science and media seem to think so. The magic 5 year mark is still the only benchmark being discussed. What does this mean to the cancer patient or survivor? After 5 years, don't expect anything? Tomorrow, that could be it. You know, don't make any long range plans. Do you see where I'm going? I wrote a book referring to a 35-year cancer survivor. Cancer patients and survivors do live well beyond 5 years, and hardly anyone ever talks about it or is willing to. Sure, I constantly discuss this, but you don't hear from it from science and the medicine community. And you definitely don't hear it from the media. But we're here. We exist. Long-term cancer survivors do live 10, 20, 30, 40, even 50 years after cancer. We do exist. And, you know, of course, the long-term survivors of cancer, we know things need to be shared with cancer patients. And those survivors going for the 5 year mark. Too many doctors today still are not having the discussions that need to be had with life after that 5 year mark. That time period when an oncologist likely to release their patient to go on with their life. First, understand there's a whole lot of life after that 5 year mark. And while the cancer may be gone, things have changed for you. Things are not the same for your body. They're not the same for your mind as they were 5, 6, 7 years ago. And you're not likely to be able to get that life back, and perhaps not even want to. But you have gone through an enormous trauma, and that doesn't just go away. Yes, you can go on, happy as can be, just know it's likely going to be different. Some of us refer to this as the new normal, and that's okay, because you're in remission, and that's what matters most. Even before you hit the 5 year mark, your life will have begun its path towards the rest of your life, and hopefully well past that 5 years. If what you want will likely find that career, have that family, travel, record a hit record, whatever, you will have whatever opportunities that you want to make and take. There's just one thing you need to do to increase your chances to make that happen. And it's not a big deal, but to those outside of your cancer world, they may not understand. There is no just getting over it with cancer, emotionally or physically. It just doesn't happen. Okay? It's one of the scariest times of our lives threatened by something we know that may have unalived someone we knew. And yes, there is an innocence that gets taken from us. And not getting over it or not forgetting about it does not prevent us from a long and happy life. Quite the contrary. I know that I've had a deeper and stronger appreciation for the little things. Friendships mean more, especially those who stood by me, and an understanding that I would take one day at a time. But there was one thing more that I needed to do to take better care of myself. My body was scarred by the cancer and the treatments that I went through. My body took a beating and needed to be looked after, if not by the oncologist, then my primary care doctor. You know, if you recall back in the beginning, prior to treatment, you were informed of potential side effects. Not guaranteed, but possible. There were short term and long term. And chances are the short term side effects were spot on: the hair loss, the nausea, etc. And we dealt with them and we recovered from them. But as we reached remission, the cancer gone, we no longer thought about side effects. And as the years progressed, we forgot about the late side effects that were mentioned in the beginning. And the truth is, not everyone gets them, unlike the short term side effects. But for those that do develop these late side effects, knowledge and treatment intervention is critical to long term cancer survivorship. Thanks to long term cancer survivors like me and those who came before me, who were unfortunate to be someone who developed these late side effects, medicine is now aware of the care that cancer patients should have long term. There's only one problem: the information is so slow to get out there, which is why I faulted ABC and NBC in my other video for not doing a more thorough story. Because it's not good enough to just say living with cancer past 5 years increased to 70%. The goal should be a lot longer. And some survivors are going to need help doing that. But which ones and how? There's no way to know which will end up with late side effects because no database exists or was ever created. We weren't supposed to live this long after cancer. And if you have not developed any late side effects, or worse, are unaware of the odd and unusual things happening to you medically, your medical team is at a loss. But if you're someone like me who has followed the advice and guidance of fellow long-term survivors and the need to follow up on health after cancer, there is a long life ahead. And I'm counting on many more years. So whether you're just reaching the 5-year mark or past that, you must have a relationship with a primary care physician, someone who knows your cancer treatment history. And with information provided by several oncologists and other cancer advocates on the Children's Oncology Group. Okay, ignored that it says children in the title. As much as the information pertains to radiation, surgery, and even some chemotherapy drugs used in other cancers, there is a PDF guide called the Long-Term Follow-Up Guidelines for Survivors of Childhood and Young Adult Cancers. Okay, there you will find a listing of the treatments, conditions, chemotherapy drugs, and their potential impact on particular systems of the body. This information is invaluable to a primary care doctor as it tells them what to look out for with you based on how you were treated. All the primary care physician needs to do is a simple baseline on systems impacted, like a chest CAT scan for radiation or an echo for the heart. Hopefully everything's good and the next test would be scheduled years later. But if something were found, your primary care would be able to refer you to the necessary specialist to follow up and follow their plans, whether more surveillance or other corrective action. The key is to stay on top of anything that could develop. Again, not everyone is going to develop these things, but if you're one of the unlucky ones who it does, that's why you need your primary care physician, especially after that 5-year mark. So please don't hang your head over this, and don't let others tell you that must suck having to still think about that after all these years. No, it doesn't. And you know why? Because the last 18 years of my 38-year survivorship have relied on having skilled and knowledgeable doctors and following their recommendations. And this year, I get to watch my younger daughter turn 21, and I get to watch my older daughter graduate from college. And otherwise, I wouldn't have gotten to see that without keeping in touch with my primary care doctor after that 5-year mark. Until next time, this is Paul's Heart.